Maybe your knee gets warm or swollen. Maybe it gets stiff at times and sort of feels kind of achy. Maybe it's difficult to kind of maneuver, getting in and out of the car, up and down steps. And maybe you've noticed that the pain in your knee is worse when you move around. The more activity you do, the worse it gets. The more you're off your knee, the better it is. If this sounds like you might have something called osteoarthritis of the knee. That's what we're talking about today. I'm going to tell you who's likely to get it, what you can do about it, and of course, what osteoarthritis is. Now, of course, some of these symptoms can be caused by other things too, so you want to make sure you talk to your doctor and get a proper diagnosis. But the swelling, the stiffness, the pain, the worse with activity, those are very, very common symptoms. First of all, 27 million people are estimated to have osteoarthritis. It's very common, and it sort of occurs when the cushioning between the knee joint, or at the knee joint rather, when the cushioning starts to go away. That's the cartilage. When it starts to kind of go away and wear down, and you have less cushioning between the joints to sort of pad it and take care of it. And there's less of that shock absorbing cartilage, because that's one of the things that it does. You can get the swelling, the pain, and the stiffness, and that's one of the things that can happen with osteoarthritis is we have a loss of cartilage, among other things as well. Now look, there are risk factors, right? So we know that people as we get older, our risk for getting osteoarthritis is greater. Over the age of 45 is a greater risk than under. And women actually get it more than men, believe it or not. But there are also some other risk factors. Obesity, that is a huge risk factor. Oh, by the way, let me tell you the statistic. Every pound of weight that we gain actually adds 3 to 4 extra pounds of weight on the knees. Can you believe that? Every extra pound of weight that we gain adds 3 to 4 pounds on the knees. That is huge. So we know that obesity is a risk factor. Also, certain infections can be risk factors for arthritis. Injury, like if you've had stress injuries, if you do a job that causes you to continually stress your joints, or repetitive injuries, or let's say you played sports or things like that. Also, there are some genetic conditions that can predispose people to osteoarthritis. We talked about women being more likely to have it than men. And then rheumatoid arthritis, other conditions can be risk factors as well. But this is the thing. There are things that can be done about knees that give you a hard time. As I mentioned before, the first thing is getting a proper diagnosis. You got to see your doctor to see what actually is going on. It may or may not be osteoarthritis, but let's say that it is, okay? What can you do? And of course, this is a 50,000 foot overview, right? But at least to give you some ideas. Number one, weight loss could not be more important. I can't even tell you how big that is. So if your doctor tells you that, which they probably will, please understand where it's coming from, is that it really helps unload the weight on the knee. Very important. Even a pound or two makes a difference, okay? Exercise or physical therapy can be very helpful for many. Pain relievers. There are over-the-counter ones, there are prescription ones. Before you start taking anything, you got to check with your doctor to see what you can actually take and what you're allowed to take based on your medical history. There's also injections that orthopedists and other doctors can do to kind of ease the pain in your knee. And there's also surgery as well. We always think about that as, I don't want to say a last resort, but something that we consider once we've tried everything else. There are also other potential options available to you as well. I think the most important thing is I don't want you to suffer in silence, okay? I have a lot of patients with knee osteoarthritis, and it can be super debilitating, and I don't want that for you. So if you're experiencing knee pains, you're like, gosh, I got to deal with this. You know what? I am with you. I want you to deal with it too. Make sure you see your doctors. Guys, let me know if this is something you deal with. Let me know what you do for your osteoarthritis of your knees. Let me know what your thoughts are. I'm Dr. Jen Caudle. If you've not liked and followed my page, I invite you to do so. I do daily videos on all sorts of stuff. For those of you who send stars, I respond to you personally. And also, consider joining my exclusive subscription group where you get private content, Dr. Jen Superstars. Guys, I'm Dr. Jen. Let me know if this was helpful, and I'll see you soon.